Ehiagi Anaba, a lecturer and a consultant dermatologist at the Lagos State University College of Medicine. Today, I'll be speaking on acne in all ages. Acne is commonly referred to as pimples, and it has a worldwide occurrence. It occurs mainly in teenagers, but there's a new concept called adult female acne. That's because we are beginning to see a lot of adult females with acne, and frequently acne is associated with quality of life issues. There are a lot of misconceptions about acne. People think that acne is curable, but that's not true. It is treatable, but not curable. It is not an infection, and facials are not really the main treatment for acne. Sometimes, depending on the facial done, you can actually have a worsening of the acne, what we refer to as mechanical acne. And then people talk about acne and food. In teenagers, yes, that's important. Sugary drinks and skimmed milks are important in the causation of acne, but in adults, that's not really proven. Then popping of acne. When you pop those lesions, you increase the risk of scarring. And then the use of triple action creams. These creams contain steroids. So initially, because of the anti-inflammatory effect of steroids, they are important, but on the long run, they lead to a worsening of acne. Now, what causes acne? Typically, acne is actually a disease of what we call the pilosebaceous glands. That's where the hair follicle and the oil from the skin sebum comes out. So when there's a blockage of this duct, that's when acne forms. There's a role for hormones. So hormones, depending on type of hormones, can lead to a worsening of acne. There's a role for diet, just as I've discussed in teenagers. And then there's a role for cosmetics because they tend to block these pores, and some medications, especially people who use contraceptives because of the hormonal content, then occupation, crude oil and pomade blocking the same pilosebaceous glands, and then people who have a family history, because a family history of acne leads to an earlier onset and a worsening of acne. So we have different types of acne. So there's the teenage acne, that's what you have in adolescence, and then we have the post-adolescent acne, where you have the persistent one, that's individuals who had acne as teenagers with the acne persisting to adulthood. Then those who have late onset, individuals who never had acne as teenagers now having acne in adulthood. And then those who have recurring acne, so individuals who had acne as teenagers, it healed, but then there's a recurrence as adults. What are the clinical features of acne? You tend to have pain, redness, which we call inflammation. You have pustules, that comedones filled with pus. You have comedones, what people commonly refer to as whiteheads and blackheads, and acne occurs on the face, the chest, the upper back, and the upper arms, and then you can have scarring, and then you also have dark spots, post-inflammatory hyperpigmentation. Then we talk about severity of acne. Yes, everybody has pimples, but they don't have the same severity. So in some people, acne is mild when you have just the blackheads and whiteheads. Then it can be moderate. So in addition to the comedones, you have red papules, you have pustules. Then severe acne, in addition to what we have in moderate acne, you have cysts, you have nodules. So these are pictorial examples of different severities of acne. So you see mild acne with only comedones. You see moderate acne, now you're beginning to see red bumps on the face. In addition to the comedones, you're seeing a few pustules. Then more severe acne, of course, if you see this, you would know that this is severe acne with cysts and nodules. Then we also have scars from acne. So you look at some people, you see holes on the face. So these we call ice picks and butt scars. You have keloid, you have dark spots. So these are pictorial representations of that. So you see the person in the middle with those picks on the face. So how do you diagnose acne? Typically, it's mainly a clinical diagnosis. That's you see the person and you know this is acne. Then sometimes we do a hormonal profile, because you remember that I did say that you can have a hormonal component to the causation of acne. And then how do we treat? So typically, early and effective treatment is important in preventing scars. So when people are rubbing all kinds of things on the face and think they are treating acne, not really. So you need to seek proper professional treatment early. and that you do seeking a dermatologist. Not people who say they are skin specialists. You seek a dermatologist and you have proper treatment. So treatment will include drugs, which can be in form of creams or tablets. So we do antibiotics, we do things called retinoids. You have some face washes, which are typically exfoliative. Then you have sunscreen. There's a place for lasers. Then there's something called chemical peel. So chemical peel is actually an adjuvant treatment. That's an additional treatment to the main treatment. You can't do just chemical peels and say you've treated acne. Then there's something called isotretinoin. So there's caution in the use of this drug because of the teratogenic potential of the drug. That's malformation in babies. Thank you.